So over this process, we have been in communication with the General Osteopathic Council. And the idea was we were trying to get some understanding as to where the therapist is potentially putting themselves at risk when using a high velocity thrust technique, particularly in the cervical spine. I want to know what would be the minimal standards required and expected of a therapist to have gone through. What are the minimal standards of a case history that are expected, testing and questioning? What documentation would be expected of that therapist? In case someone was to ever have a problem and end up going to a hearing or a tribunal, what would be the minimal standards? Now, unfortunately, the GOSC's answers to me were somewhat subjective and quite vague. Didn't really give me massive amounts of information, which in my opinion is somewhat problematic. Now, as practitioners, our priority is ensuring patient safety, whilst also protecting ourselves professionally. Now, while the General Osteopathic Council does provide a framework, there are significant gaps that we need to address to safeguard ourselves, our professionalism, our reputation, and our practice. So, what does the GOSC provide? Well, the GOSC highlights the osteopathic practice standards, and this is what we follow as allied health professions. Now, they include things like maintaining knowledge and skills, working within your competence, ensuring patient evaluations and care are safe and evidence-based. The GOSC also encourages us to use resources such as the NCORE research, the IFO-MPT guidelines, current evidence-based information around safety protocols. And let's be fair, these are positive steps to emphasize professional judgment and patient-centered care. But there are significant shortcomings. However, the guidance they have given us is vague. It doesn't offer any specific protocols for high-risk interventions like neck manipulation. Nothing. There's no checklist for minimum screening standards for vascular risks, or contraindications, or consent procedures or processes, and these are left massively open to interpretation. They're incredibly subjective. This subjectivity can lead therapists, incredibly uncertain about compliance, and unfortunately very, very vulnerable to complaints or legal issues. So why does this matter? Well, without clear protocols or minimum guidelines, therapists are left alone to bridge the gap between these broad standards and practical implementations. This can lead to errors, even with the very, very best of intentions. Missteps in screening or treatment selection can result in harm, reputational damage, and potentially regulatory scrutiny. Now, what can therapists do to protect themselves? So, to protect yourself and your patients, this is why we've compiled this massive course. We want you to use a comprehensive assessment protocol, such as vascular screening tools that we've highlighted, case history, blood pressure testing, standardized testing, develop a standardized consent process, a shared decision-making process that clearly explains risks, benefits, and alternatives. Stay informed through CPD, peer discussions, and good evidence-based practice resources, ones that we've provided in the course that you're accessing now. And also, guys, Keep meticulous notes, records of evaluations, treatments, and patient communication. This is essential for protecting yourself and to ensure clinical practice is as professional as possible. Taking these steps will ensure your compliance with the GOSC standards and reinforce your commitment to safe, ethical practice. Guys, while the General Orthopaedic Council provides a foundation, the reality of this whole process is the responsibility falls on you and me. It falls on us to bridge the gaps. And being proactive and using evidence-based tools, using good, clear information, shared decision-making, prioritizing clear communication allows us to deliver safe and effective care while minimizing the risks. We have to look at protecting ourselves professionally as well as protecting the patients. Now, we've consolidated the information from the email exchange that we've had with the General Orthopaedic Council in the table following this little video. It looks at what they discussed with us, it looks at the positives, it looks at the negatives, and it looks at what you can do as a therapist to protect yourself. Now, remember, guys, unfortunately, you are the expert in the room. You have to document things, you have to write things down, you need clear decision making. You have to be able to justify every single technique that you use on that patient. So if you're ever in a tribunal, if you're ever in a hearing and you're gripping the rails and that defense barrister or prosecuting barrister is saying to you, okay, so you decided to crack that patient's neck, you have to be able to explain why you wanted to use that technique, what the outcomes were, what the clinical thought process was, what the safety measures were, and then why you did it, when you did it, how you did it. You have to have a continuity of care. It's not good enough just to say, oh, well, you know, I'm just going to crack the neck and see what happens. This is when mistakes occur. Now, I'm only talking from the UK where we are heavily regulated, but this is, in my opinion, a standardized approach that anybody across the world should be using if they are employing high velocity thrust techniques in their clinical practice to protect themselves and to ultimately protect the patient.